Well, hello. My name is Colin Vickrey. I'm a rising junior at Princeton University studying ecology and evolutionary biology. And my project is about the observational study of medical outreach sites during the cervical cancer screening program. And so far to this date, we have seen 426 patients in 11 different sites across Ecuador. And it's important really just because that cervical cancer is the number two cause of cancer death among Ecuadorian women under 50, which is a really crazy fact for to be the number two cause of cancer death. So the purpose basically what we want to get out of this is that we want to help optimize future clinic locations and setup. Also, we want to reveal how geography and infrastructure affect care access, and as well as support more efficient patient-centered delivery and future caravanas in remote settings. And so basically, during this survey, we conducted site analysis of each town and clinic where caravanas operated, in which we would document accessibility, infrastructure, and local conditions, assess as clinic spaces, electricity, water access, patient flow, and privacy. And then as well, we took field notes on how the geography, roads, and layout affect care delivery. While also doing this, we identified barriers such as like remote roads, limited resources, and then also kind of the strengths of the community, such as like community engagement, central clinic location. And all in all, this will advance PACH's and FIBUSPAM's goal of providing access, dignity, and trust in healthcare. So our methodology of doing this was we had 11 destinations. Most of the patients have, once they've gone through their vital signs, which Isher, Henry, and I would take. After that, we would then go and walk around the town and take notes about what we saw. And so basically, again, it's the setting of the outreach, description of surroundings and landscape, weather, infrastructure of caravana, safety and accessibility, economic activities around the town, cultural aspects, community response, and insights about the community's health. And here you could see a map of the 11 locations. So the first 2 weeks of this internship we spent in the Amazon. And so we first started out in Palora, then went to Huamboya and Sakua, and then we went down south to Loja. After that, we then had a couple caravanas for about a week or a week and a half, 2 weeks, around Riobamba and then also getting up to Latacunga as well. And so now I'm going to talk about some of the things that we took away. And so first is the environmental hazards and barriers, in which we at times we'd often see outside waiting areas, which could be hazardous just because of the unpredictable weather there is in Ecuador, as it's being cold in the morning and then it could get pretty hot in the sun in the afternoon. And then also the rough terrain and poor road conditions. So luckily, most of the days when we had outdoor seating were sunny. But there were some instances such as like Kacha where it was very cold and we were up on like a hill, so it was very windy, which a lot of the elderly patients complained about. And then there were also some other locations that did not have enough chairs, so some people had to stand, which could be a bit troublesome whenever they're waiting for a long duration for to see the doctor. And then also a lot of locations did not have heating, and which meant the early mornings, whenever the patients would show up at 7:30, 8 o'clock, it'd be really cold, especially in the mountains. Not so much in the Amazon, but really in the mountains. It was very cold in some of the clinics, which also is not the greatest thing whenever they're having to change their clothes to get the cervical cancer screening. And so why this really matters is that we want to, like, it affects the quality, safety, and the efficiency of care. And then how we can adapt is just like the need for flexible adaptive clinic planning. And so next we're going to be talking about the accessibility challenges. And so this was a big issue because of a lot of the patients being elderly, in which there were a lot of mobility issues. It was often hard to get to some caravanas because of damaged roads. And then also, depending on the region, there were language barriers as well, especially in the Riobamba area whenever we went to the Cacha um, outskirts where almost everyone spoke Quechua as their first language and not so much Spanish. And so why this really matters is that um, it impacts patient safety and comfort, delays clinic flow and organization. It can discourage future visits and helps prioritize site planning and adaptive clinic design. And so next is going to be the cultural and community dynamics, in which we really saw that there was a lot of really strong community bonds, and then the local leaders, which was mostly made of the mayor's wife, as it's culturally custom in which the wife of the mayor would take in the wellness of the town. And there were also some issues like in the sense of gender barriers, delayed visits, and fear of recovery time. And this was really due to the fact that in some towns the woman they would be like working in the mornings and they wouldn't be able to come to the clinic until after their work is done. Or also they were scared of coming because of there might be a recovery time in which they may not be able to work. If they're not be able to work, they may not be able to put food on the table or get money. And so this really is important just in understanding and respecting cultural norms as it will build trust and participation within the town. And then also community collaboration ensures care is always welcomed. So now I'm going to get into some of the recommendations for future caravans. So first is just about a study with patients to gather feedback. And so there'll be a general survey in which it could talk about the unmet health needs, the desired services for this region, difficult getting to the caravan location, and any other major inconveniences related to the caravana, and then also just general feedback. This really became a thought to us because when we were in Latacunga, a man came up to us and was like, "Hey, like I want you guys to come, but I need different needs than just kind of like a cervical cancer." He wanted a general caravana where we have several different specialties. And so this could be an important thing whenever we're in certain regions because certain regions have different health effects where they have suffer from different things that occur from the day-to-day basis that they do. And so this could really prioritize the services for future caravanas. So then we're not going to a place or region that does not need a service in which we are providing. It would be a waste of money and a waste of time for us to go to somewhere and not many patients want to see that specialty. Whereas if we kind of have a feedback, if we know what we're doing and know what they want, then we can get there and it would also be a bit more specialized to each region. So next is a community education booth. And so this could be topics like hygiene, nutrition, sanitary water, family planning, etc. And so this goes in part with Halal's video in which he showed, and that's how I got this idea, is that during our general caravanas, when we had several different specialties, there were a lot of especially like hygiene with brushing their teeth and taking care of their teeth in general. It was like a huge issue with the dentistry as he was most likely the last specialty at all times to finish because of the number of patients and also the amount of time that he had to like spend with each patient. And then there's also a huge thing with sanitary water, and that's because in kind of the outskirts of Riobamba, what I've learned from Dr. Rodrigo is that they'll if they they don't buy bottled water to begin with, but then also if they purify the water through some like chemical compound, pouring it in or something, and the kind of stuff that you need to remove off the top of the water is that they don't do that. They pour it in and then they just kind of drink it and thinking that just putting it in is good enough. And so just in general like of teaching kind of the basics of hygiene, nutrition, sanitary water can really, I feel like, improve the health of many people around here. So next thing is prioritizing patient comfort. And so this is going to be having tarps, tents, chairs, and then possibly even investing in space heaters because in certain aspects, in certain regions, um, there was a very like high winds, and that would be great to have tarps where we can maybe block the wind and be able to like make the patients a bit more warmer because most of the outdoor seating area was exposed to the elements, and that could also help with tents. Whenever in Kota, the patients in early in the morning, they would sit out in the sun. But then by around 10, 11 o'clock, you saw like a shift in where the patients would start sitting under the tent. And the thing is that we only had one tent at the time. So it was hard to fit all the patients underneath one tent where they could be under the shade, where we were also trying to show Halal's video as well. And then also the space heaters thing could be a great investment just in general of possibly putting it in areas um, that are cold. Like for instance, when we were in Banos, we were in like this kind of big old building, but the wind would come in and it was freezing cold. A nice like having space heaters could be a huge difference maker, not only for us, but like mostly just for the patients. Next thing is an improved organization system. And then what I'm really talking about is a organization system for the general, like the multiple specialties. Because oftentimes there would be like they would come, sign in, and then they would go kind of like scatter off, and we would not be able to know who's next in line for vitals, who's next in time in line for the doctor, stuff like this. And so there could be multiple solutions to this. The two easiest ones that I thought of would be if space is available, we'd be able to have different sections where the patients could sit, which oftentimes two was an issue just because they would bring a family and different family members would see different specialties and then they would sit different they would have to sit differently, but they would always want to sit together. So I also thought about like having color coded papers as whenever they sign in, they often would like whenever we would go and check for their paper and see what they were looking for, it was often hard just because every paper is different, but they look the same from afar. And so we would have to go up and meticulously look at the paper and see what they had. So color coding papers could be a huge like shift in general for better organization and better like speed and not having to run around the waiting area and see who's next, see who's next in line for vitals or even just to see the doctor. And then next are some possible FIBUSPAM hospital recommendations. This is all to improve like the efficiency of the hospital as well as um, kind of help with patient comfort. And so first thing is implementing a simple electronic prescription slash imaging system. So I spent many days with Dr. Rodrigo, who's a general family doctor. And so he would see a lot of patients that needed tests, like imaging or even blood tests, or they would be sick and he would write them prescriptions. But for every single time, whenever he did that, he would print it out each separate thing. A whole paper for the testing, a whole paper for x-rays, a whole paper for all the prescriptions that they were prescribing. And so to maybe save paper, which could save money, and to overall just speed up the process, is that he would write it in on an electronic system. He writes in all the notes and stuff, and he writes in the prescriptions and the imaging on the laptop. Now, just a way for that to be sent over to the imaging, like the X-ray center and also the pharmacy. Another thing is possibly introducing a surgical timeout protocol. And so this is actually organized, and this is came up through the World Health Organization. And so this is a big thing that I've noticed whenever I've received surgeries, or I've also been a part of surgeries, like shadowing surgeons. And before every single time, they would have a timeout protocol in which they would go over the name, the date of birth, allergies, and the type of surgery and location of the surgery. And so I felt like this is really important just because as of yesterday, whenever looking at the schedule, the surgery schedule, there was a mistake on the surgery schedule in which it said left eye, but they were supposed to do surgery on the right eye. Luckily, the surgeons did catch it in time, so they didn't operate on the left eye. But this is just a circumstance as well. Another thing is that I've seen lots of surgeons, they ask the patient like what their name is on whenever they're sitting on the surgical bed. And for me, I feel like it would increase a little bit of anxiety if the surgeon is asking my name right before I get knocked out. So another thing is having more reliable supply closets in each room. I've noticed the otorhinolaryngologo doctor, um, she had to leave the room one time to get saline while like she was cleaning someone's ear. There was also another like every single day, Dr. Rodrigo has to leave his room to go get some tool to look in their ears, look in their nose, or even like listen to their heartbeat and breaths. So just having like a supply closet in each room that has like what is necessary for each doctor could save time, but then also not have the doctor have to leave the room while the patient is inside. Another thing I thought of is training for local caregivers. This came up is because I've noticed a lot of elderly are cared for by their own parents or sorry, by their own like daughters or sons. And this is became important to me because Dr. Rodrigo and I went on a house visit in which we came across a 85-year-old gentleman who has developed hypoxia because his family didn't know how to like care for him. They would put the oximeter on his finger, but then it would read wrong. And so then they were reading the data wrong, in which he wasn't getting enough oxygen, and so basically which left his lungs, his kidneys, and his heart just in bad shape. And so overall, he was just in a daze all the time. And so I feel like if you have like on a Saturday or Sunday morning ish, you could have like a training for parents or for people who are caring for their elderly, because I do feel like it's a common thing here that occurs. And so with that, I want to acknowledge everyone that has helped me across the way. First off, the FIBUSPAM directors for enabling this to happen, as well as the PACH staff, including you, Zach. And then also the FIBUSPAM staff that has been very helpful, like Devi Guacho, my homestay, Dr. Rodrigo, and then also all the doctors and surgeons that I've shadowed. And then I also want to thank the PACH intern team just because it's been such a special experience to be here in Ecuador with them and spending the time with them. and then also Princeton University for enabling this to happen, especially with you, Paloma, because you've been super helpful with me, and especially our medical Spanish class actually prepared me a lot for being down here, and I've really strengthened from the spring. So I'm excited to come back on campus and actually talk in Spanish with you. So yeah, well, thank you guys very much.